So, is there a need for change? Well, yes, there probably is. Really, we need to listen to people with MS more about what they find important in terms of monitoring. It's all very well adding together these findings that we see on examination, but actually if they don't mean anything in real life, then does this make any difference to you if our treatment says that you can do something differently, but it doesn't make any difference? So there are problems with the EDSS. People have to come into hospital to see a neurologist, and it takes 30 minutes once you're there. So, you know, it's half a day potentially if you've got problems with mobility, involving all the travel time. And it is things that we see as important on the neurological examination that may not be important to actual people with MS. And the fact that you have to come into hospital may have problems with how often people can be monitored. You may not wish to come into hospital, you know, or come into the clinic more than every 6 months or so. And really this is becoming recognised as increasingly important, with the American authorities requiring clinical trials now to include patient-reported outcome measures, and the Europeans are likely to follow suit. So we really do have to think about how we can change our outcome measures to be more patient-friendly. So, what does the future hold? That was, after all, the title of my talk. Well, previously self-reporting has been tried. There's some promising results, especially with regard to self-reporting the higher scores of the EDSS, which, as you may remember, are those regarding walking. So those are the ones that are very easy to assess without having to see somebody. However, it's more difficult to see more subtle changes, for example, changes that you find on examination, without actually bringing somebody into the hospital. There has been trials of telephone assessment, and these have come across the same problem, that higher scores, so more disability, you can assess quite easily. Lower scores are much more difficult. But there is a protocol published for telephone assessment of EDSS. This indicates that face-to-face assessment might not always be needed. So the work that we're doing is looking on harnessing the internet and the power of the internet to assess outcomes in multiple sclerosis. So at the moment, or in 2008, 18 million households in the UK had internet access. That's 70% of the total UK population have access to internet at home. And so we thought, why not try and use this to reduce the need for people to travel into hospital. So what we've tried to do is set up an internet-based survey to assess both the EDSS, but also try and improve on the EDSS and gather information about what outcomes may be important to people with MS. So we've set up a survey that is similar to the EDSS, but has more subtle questions, especially around the issues of mobility. The opinions of people with MS have been taken in the preliminary survey, and I expect there's probably a few people who've contributed to that here today, so thank you very much. And there's positive feedback regarding the concept of internet-based monitoring, and also suggestions regarding the wording have been taken into account and things that people find important. We've actually set up the survey, and as with all things that involve asking you to do things, we're waiting for ethical approval before we can actually start enrolling people formally for more widespread testing. So, briefly in conclusion, patient-reported monitoring is increasingly important in clinical trials, as I've mentioned, but it can be used in a far wider setting and to do with monitoring the disease course in people not on trials, so making decisions about whether to try therapy, when to try therapy, whether therapies are working, and really giving some of this information back to people with MS rather than it being very doctor-heavy and doctor-based. And in doing this, we have the opportunity to improve on existing monitoring techniques, but really your input is vital into getting this set up, and so that we know that our measures are good and that they mean something to both us and people with MS, and that they are reliable. So I'd just like to say thank you to the Guarantors of Brain who provide my salary at the moment, and to Professor Giovanoni, and also everyone who's provided feedback on the website so far, and hopefully to everyone who will do so in the future. So any questions?